Low back pain is one of the most common musculoskeletal pains or injuries that people experience, with an estimated 80% of people having at least one episode of low back pain throughout their life. Not only this, but low back pain affects people of all ages and activity levels, all the way from sedentary individuals who don't do any form of structured exercise or training, all the way up to elite level athletes. When we at Barbell Physical Therapy and Performance work with our clients who are dealing with low back pain, one of the most common things for them to think or be told from other healthcare providers is that their back pain is most likely the cause of a lumbar disc herniation. A lumbar disc herniation is when the central portion of the intervertebral disc moves outside of where it normally is and can place pressure on a nerve root in the lumbar spine. With how many people deal with low back pain and how frequently they're told that disc herniations are the cause of their pain, the question is a disc herniation actually the cause of these people's pain? And honestly, the answer is probably going to surprise you. Also, be sure to stick to the end of this video because we're going to cover the top 3 tips that we have and use with our clients to help them continue training around low back pain. Now, the truth of the matter is that in the vast majority of cases, a disc herniation is not going to be the cause of somebody's low back pain. In fact, it's been shown that only approximately 1 to 3% of episodes of low back pain are actually caused or significantly contributed to by a lumbar disc herniation. That being said, disc herniations can still cause or contribute to back pain even though it's a small percentage of cases. And when you're looking at whether or not a disc herniation is the cause of somebody's pain, there are 3 main things that we look for that would identify that a lumbar disc herniation is likely a big cause or contributor to their pain. These 3 signs and symptoms are radicular pain, sensory changes, and weakness along a specific nerve root distribution of the lumbosacral nerves. Radicular pain for the low back is when you have pain that's running down the leg in a specific distribution or specific pattern that's linked to a specific nerve root in the lower back itself. For instance, the L5 nerve root in its usual distribution for radicular pain is usually from the buttock, down the back of the leg, to the outside of the ankle, and to the top of the foot towards the big toe. Now, it is important to note that there is a pretty big variation in the actual distributions of radicular pain for people who are having these issues with specific nerve roots, so this is not the most accurate way to tell specifically where in the lower back a disc herniation might be if these 3 signs and symptoms are present. The second big sign or symptom are sensory changes such as numbness, tingling, pins and needles in a specific area in the leg. The last major sign or symptom of a true disc herniation causing issues is weakness in the leg in a specific pattern that correlates with that nerve root. This is a much better predictor of the area of the disc herniation if it's causing the issue, because we know that specific nerve roots and their peripheral nerves innervate specific muscles, so this is a much more reliable way to tell where an issue might be in the lumbar spine. For instance, if you have an L5 disc herniation, you're more than likely going to have weakness in raising the big toe up off the floor into extension. On the other hand, if you have something like an L3 disc herniation, you're more than likely going to have some pretty significant quadriceps weakness because that is the nerve root that is responsible for quadriceps motor function. Other common but less specific signs and symptoms for disc herniation include things like limitation and pain when flexing your spine, a positive straight leg raise test, or an increase in symptoms with coughing, sneezing, or bearing down or straining. So if you're dealing with pain that's just in your back, doesn't go down the leg, and you don't have any accompanying motor weakness or sensation changes, then it's very, very unlikely that a disc herniation is the actual cause of your back pain. Regardless, dealing with back pain of any type can be a very frustrating situation, and it can make it sometimes feel impossible to continue training or doing the things that you love to do. So with that said, we're going to give you our top 3 tips to continue training and lifting while dealing with low back pain. The first tip is to lower the overall weight that you're lifting, as well as do lower volume of training. Doing fewer sets per exercise and using things like slower tempos or longer pauses in specific parts of the range of motion are great ways to reduce the weight and volume that you're lifting while still getting a good training effect. Tip number 2 is to reduce the range of motion that you're moving through. Many people dealing with low back pain have more pain when squatting all the way to the bottom of the range of motion or when deadlifting from the floor. So if you can do things like box squats at certain heights or pulling from risers or rack pulls, that can be a great way to continue training these movements that often flare up people's back pain without actually flaring up your pain. And the last tip is to try to keep your back moving through different planes of motion, different ranges of motion that are relatively comfortable. The last thing that you want to do is just keep your back completely stiff and unmoving, as this will actually likely increase the length that you have symptoms and make it a longer recovery to the point where you're feeling better. Let us know in the comments below what you've done to help your back pain, and make sure that you subscribe to our channel for future information just like this.